really appreciate that. So as Aldo said, I'm going to now hand over to Kirstie Whitaker, wonderful colleague from the Turing Institute. And Kirstie's the PI of the Research Support Facility, and we'll be talking about an overview of the AIM programme and the RSF. Thanks very much indeed, Kirstie.
Thanks, Aziz, and thank you, Aldo. And thank you all of you for coming along, everyone online, everyone in the room. It is so exciting to see how tall you are, because I just see your head and shoulders on all of the different Zoom meetings that we have. This is me. So many of you will already know that, sorry, I've just realized that I don't have my glasses on and I can't read the prompter. So give me 1 second. The NIHR invested £23 million in funding 7 research consortia and the Research Support Facility to make sure that we were that we were going to grow capacity and capability for multidisciplinary working in MLTC for the benefit of patients, practitioners, and the public. Thank you. I really apologize for that. I have them in my bag. And I definitely can't read this slide. And none of you are really supposed to read this slide. But this is to highlight just the diversity of the types of work. And I wanted all of you to see your team, your program on the slide here. And you'll note that there were 7 research consortia who were funded, but there's 8 bullet points. And as you can see, data changes as it goes through a process. And we want to welcome Compute, who joined our consortia team just last year. So the AI for Multiple Long-Term Conditions Research Support Facility has 5 different themes, thinking about how we can support everyone working on reproducible and interoperable infrastructure, research-ready data, community building and training, patient and public involvement and engagement, and as Aziz is leading on, the sustainability and legacy of the work. And we're delighted to lead this through the Alan Turing Institute, but with partners at the University of Edinburgh and Swansea University. And the prompt for my first few minutes here was to think about our impact, our key achievements, and our lessons learned. And I wanted to highlight that I think one of the best impacts that we have is the fact that we have really meaningfully shaped the research through engaging with people who have lived experiences of multiple long-term conditions, whether it's their experiences or as carers or family members for people who have those experiences. We are delighted to co-lead the multiple long-term conditions community of practice. This was originally created as a space to bring together early career researchers who were maybe a little bit nervous about engaging with people who had lived experiences of navigating the healthcare system. And I love this quote from Amanda that says, I'm a patient voice. I see my role as more to reassure early career researchers that we're not scary and can help them do things better. Thank you, Amanda, and thank you to everyone who's been doing that work. And for Margaret, the advantage of the community is that it's a big PPIE group. The meetings are well attended, and it includes members of the research teams that come along as well. It's a well-developed group, and we're really, really keen to make sure that this community stays together and continues to meaningfully feed back into the design and the development and the delivery of the AI work that we're completing. I think one of our big key achievements from the AIM RSF is that we have supported a lot of the different teams who are working to work effectively with sensitive data. At Sale Data Bank in Swansea, we've made sure that those of you that need to have access to a GPU capability, which gives a very high compute opportunity, and therefore, as I've said on the slide, unlocks the possibility for novel and cutting-edge data science solutions. And then data wranglers at the Turing Institute have worked with the AIM consortia to align data sets and standards. And I've put on this slide again 3 different GitHub repositories that are all open source and allow people to learn from the work of others so that we can minimize wasting time reinventing the wheel and be able to deliver work that is interoperable with each other, so we can learn to see how similar our work is and how different it is. I think another huge key achievement is the way in which we have learned from and learned with the early career researchers. This photograph was taken at the Turing Institute in November of last year, and it was a brilliant opportunity to learn from and connect with peers in the community who might otherwise take years and have the opportunity, you may have to move around the country to be able to actually meet in person and talk to. It's a fantastic event, and we need to do this more often. So hopefully there are some folks here who are enjoying the opportunity to come together. And I also want to highlight that it isn't just about bringing people together. We also have delivered online trainings, and we've made all of those openly available so that people can use them at the time that best fits them. They know that it exists. And we hope very much that early career researchers in the future and next year and next year and next year will be able to benefit from those materials as well. I think the big lesson learned is this catch-22 of collaboration and designing AI for deployment. And so just to define a catch-22, if you haven't read the book, that it is a dilemma or a difficult circumstance from which there is no escape because of mutually conflicting or dependent conditions. And the examples that I put on here are that skills in reproducibility and open science are hard to motivate if you don't have access to data. It's very easy to say, I will think about those later. But once you get down to later, you've got other pressures and it's difficult to learn them. They also need to be implemented as early as possible. Project plans are defined before the funding is awarded. So everyone here wrote down and went through a rigorous peer review process to define what they were going to work on. But what that means is it's very, very difficult to change what you're going to work on because you've already got the money to say to do the thing that you said that you were going to do. It's hard and it's not impossible to change a plan. And we actually have some speakers today who are going to highlight how they have adapted some of their work because of the input and the collaboration that they've benefited from. And then also ethical and regulatory considerations. If you really want to make sure that AI is responsibly deployed to improve patient lives, it's almost impossible to define without already analyzing the data, but then you need to go back through another iteration to put in your ethics to think about how you're going to do it again. And that leads to a need for iterative development, which is not incentivized by the academic reward system. So these are the challenges, these are the challenges that we are trying to bring everyone together to support. So as a PI, this is from Raphael from Compute. If the RSF isn't there, it becomes my job to do all this, and it becomes an extra burden of work for me. The work may or may not happen, and it could delay best practice in the area. And from Bruce, capturing what the consortia have done in a rigorous way, including the problems that they have faced, is something the consortia would never do themselves. It is not incentivized to talk about all the things that you struggled with and that you weren't able to do. And so I will finish by saying we are learning all of this with you today. I want to give a huge thank you to Rhonda, who is our medical writer, who is going to capture notes from all of the different conversations that we have today, and we'll write up and provide a little handbook that hopefully we hope that you will share with your colleagues and continue to learn from. Thank you so much for being here.